thank you all for being here. My name is Kate Bremen. I'm the director of Environment Maryland. We are a statewide environmental advocacy nonprofit, and we work on a variety of issues. Plastic in particular has been a big one for us. I'm really excited about this panel because for those of you who are joining us, I imagine you already know that plastic pollution is a huge threat to our air, our water, our wildlife, our climate, and our communities. But today we're going to dig into the threat that it poses to our own health. During this COVID-19 crisis, we've seen the plastic industry pushing hard to pause and even roll back legislation on single-use plastic across the country. And they've done this by arguing that reusables are not as safe as single-use during this time, but we know the data doesn't support that claim. At the same time, we've seen the use of single-use plastics increase astronomically. If you are on here, you probably know why that's a concern for our planet, but today we're going to talk about why that should concern us when it comes to our own health. So we're going to hear from our three panelists. The order that we're going to go in today, Melanie has a meeting she has to get to, so we're going to let her go first, and then I think she's going to have to hop off. So if you have questions for her, I will get them to her, and then we will hear from Dr. Loughlin and Dr. Bruno. And so logistics really quickly, if you're on the Facebook Live and have a question, just put it in the chat. If you're in Zoom and have a question, same thing, you can put it in the Q&A or the chat. We're going to save them till the end, but you're welcome to put it in if you think of a question while a panelist is speaking and you don't want to forget it, just put it in the chat and we'll answer it after everybody presents. So right now I want to do a quick intro of our first speaker, and Melanie, I'm going to share my screen for you here in a second. Just so everyone knows, Melanie Thomas is a community organizer with the South Baltimore Community Land Trust. She's a published author and a youth and family advocate. She has over 15 years of serving youth and families in various capacities, some of which include case management, family support services, and after-school programming and enrichment. Presently, her work focuses on mobilizing youth and community leadership around environmental injustice and affordable housing support. Melanie believes in equitable, fair development and continues to advocate for marginalized communities like the one in which she resides. So Melanie, thank you so much. I'm going to turn it over to you and I will share your presentation right now.
Thank you. Kate and everyone at Environment Maryland and all the panelists and attendees that have joined us. Thank you all for the invitation. Very excited to be here. Let me know if you can hear me clearly. Is everything good? Thumbs up? All right. Okay. So thank you all again for the invitation. As Kate just said, I'm Melanie Thomas with the South Baltimore Community Land Trust. And at the South Baltimore Community Land Trust, we really focus on, you can go to the next. Uh-oh.
Sorry, I got it. Let me pull it up through the download. I apologize.
Okay, no problem.
No pressure, Kate.
It is okay. Listen, we take a breath. All good.
All right, there we go. I just wanted to be able to make it bigger. It's like we've been on Zoom for 7 months. How do I still not know how to do this? But anyway, there you go.
It is all good. So we are creating community-led development without displacement and zero waste in Baltimore City. Be sure to follow us. You'll see our contact information below, but follow us on Twitter. I get to work with some amazing youth leaders in South Baltimore, most from Benjamin Franklin High School, which is right behind the development that we are currently working on, which will produce 9 to 10 new affordable homes in our community. And our community hasn't seen new development per se in the last 20 years. So this is something that is really huge for us. If you can scroll down to our values. So SBCLT's values, we believe in advocating for zero waste and against incineration, empowering authentic youth leadership and advocacy for our basic human rights. We have a right to breathe clean air. We will not compromise with our lives or the lives of others that are most at risk, especially during this pandemic. And you're probably wondering, well, why am I talking about, incineration and all of that now, but I'll get to it pretty soon. Next slide. Okay. So this is just the image of some of our youth leaders at our community-owned site, where they are speaking with our incoming councilwoman, our incoming mayor, and a lot of senators and delegates and representatives from Philadelphia about the importance of owning land and what happens to land that is not owned and unused, right? So just a little background about SBCLT and Free Your Voice, which is the entity under that, right? So Free Your Voice leaders, it was a group of high school students with their leader, Gregory Sawtell, who formed this campaign to stop the proposal of what would have been the largest trash burning incinerator from being built in our community in Curtis Bay. In Curtis Bay, you'll see a little bit later, we are saturated and overburdened with polluting agents. We prevented Baltimore from becoming the trash burning capital of the East Coast and Mid-Atlantic. And with that, we've built community power and organizational structures to lead a just transition to zero waste, creating Baltimore's Fair Development Plan, which City Council unanimously adopted this year. Why do we have a plastics problem and who pays the price, right? So I told you we'll get to that question because this panel is on plastics in the pandemic. And we need to understand what plastic really is and how plastics are made. So trillions of subsidies are provided to the fossil fuel industries. And with all the subsidies, the subsidizing for that, they're like, okay, we have all this. It caused a boom in plastic production. So that's why we see plastic in pretty much everything, right? And what happens, if you can scroll down to the next slide, the National Geographic, 91% of plastic isn't recycled. When we talk about plastics, it is trash really because it cannot be recycled. They've predicted that by 2050, there'll be more plastic in the ocean than fish. That is a huge problem. And that's why we're here today, to really talk about the plastics problem and talk about the issues that it's placing in our communities. Plastics are not the answer. Yep, you can scroll down. Yesterday, this image is just from yesterday. It's right out front of the Bresco Willebrator incinerator in South Baltimore in Westport, not too far from where we live. And our youth and many of our other supporters and allies came out and they created all of these tombstones and we placed them in front of Bresco because it represents that when I talk about plastics, we consider it trash because it's being burned. And right now in Baltimore City, our recycling has been suspended. Right? It's been suspended. It was supposed to be suspended until November, and now it's pushed back to December. People that don't have access to vehicles or transportation are not able to transport their plastics or whatever it is that their cardboard or any recyclables to the drop-off locations. So what's happening? It's ending up in our trash. So that is why I'm focusing so much to kind of highlight the effects of what we do, the overproduction of plastics and trash, and then how it harms communities like ours. Now, I can't see the other attendees, but I'm sure that somebody on the call has asthma or other respiratory illnesses, right? Many of my family members, I know moving here, my allergies and my sinuses have been just horrendous. And when I learned about just the pollutants and the emissions from this Bresco incinerator and some of the other polluting agents around us, it really caused me to think, well, wow, you know, what can we do to really help ourselves and our future? These are two of our youth leaders that are really freeing their voice, you know, within the group and just really showing and shedding light on the harmful impacts of incineration and what happens to trash and things that we create that are single use that end up in our trash because it doesn't just end there. Now, interesting fact, Bresco needs to burn 722,000 tons of material to stay in business. But in Baltimore, we only send 127,000 tons of residential material to them. So where is the trash coming from? In response to the Clean Air Act from Energy Answers, Wheelabrator sues Baltimore County and also Baltimore City. They sued Baltimore County for not sending enough trash. Baltimore County was reducing their residential waste, but what happened? We just learned that a contract renewal is pending. It's supposed to go before their board, the Board of Estimates, on Monday. We cannot continue to overburden communities in South Baltimore and other communities like ours with trash. Plastics are trash, right? They cannot be recycled. If we don't have ways to effectively recycle them. And as I showed you earlier, only 9% of plastics ever created have been recycled. That's a huge problem. And down there in the map, that concentration is where we are. That's where I live, right? Where all those polluting agents are concentrated. And this isn't by accident. You know, it's minority communities. They're communities of, just low economic status, and we deserve a right to breathe clean air. We deserve a life, and we cannot continue to be overburdened by polluting agents as the Bresco incinerator. So our Fair Development Plan was created by Gary Liss, who's worked on so many numerous plans throughout zero waste plans in the country. And he, along with the team, we really went to different residents to get their input on what they wanted to see in their community. And our goal and our hope is that you can scroll down to the next slide, that we can create this bridge strategy for Baltimore, where we're moving away from incineration, moving away from our reliance on burning and burying to a zero waste future. And with that, we'll have clean air, cleaner communities, we'll reclaim communities, more jobs, less waste, and build community power. This photo was just a demonstration where we shut down the traffic to the Bresco incinerator for a few hours during the pandemic. Why? Because this matters to us. This is our life. This is our future. And we have to take a stand and advocate for what is right. You can scroll down. So the bottom line, scroll down one more, sorry. So what do we need to do now? We need to build pressure to block the contract renewals from the city as well as the county. As I said, the county is set to vote on their renewal for another 5 years on Monday. We need to be bombarding county council members. We need to be bombarding the city council members to make sure that they do not follow suit, that they choose people over profit. We need to understand that single-use plastics is not the answer. It is not safer during the pandemic and only contributes to more trash being burned. We need to commit. We need a commitment to end Baltimore's contract with the Bresco incinerator, which ends in 2021. We do not need a renewal. We do not need a renewal. And during this time, we need to follow and implement that bridge strategy that we just talked about. We need to hire a Department of Public Works director who will support a just transition to zero waste. We talk about plastics in the pandemic. Bresco is our pandemic, and we need a positive future and a healthy future. So again, thank you all for the time. Thank you, Kate, and Environment Maryland supporters and friends. So just stay in contact with us. You can email us at mysbclt@gmail.com and donate or follow us on Twitter and Facebook, Baltimore South and South Baltimore CLT. Please stay connected. We want to hear from you. And Kate, I think I saw a question pop up about, will the slides be shared? And you're welcome to share the slides. And again, people can contact us for further information. But thank you all again very much for the time to just talk about, what's happening in our community and how the plastics really is an issue for us and other places like us.
Thank you so much, Melanie. Sorry, that was really, I don't know what the word is, because it was so wonderful to hear from you, but also there's so much work to be done. And so I know that Melanie has to hop off, I think, to go to a meeting. If anybody has questions, if you RSVP'd with your email, I will send you the slides because I have it. If you're on Facebook Live, please feel free to send me an email. And I also, at the end, when we get to the Q&A, will put in the chat how you can follow the South Baltimore Community Land Trust on Twitter, and how you can link to their PayPal. So I'll put all that in the chat once we get through our panel. So again, thank you so much, Melanie. I will make sure everyone knows how to get in touch with you, and thank you for the wonderful work that you're doing.
Thank you again. You all take care.
Thanks, Melanie.
Bye-bye.
So in order, I think, to keep sort of this flow, if it's okay with Dr. Bruno and Dr. Loughlin, I think maybe it would make sense for Dr. Bruno to talk about kind of expanding upon the public health impact, and then save time for Dr. Loughlin to really get into this piece of COVID-19 specific and transmission. Does that work for the both of you?
Yeah.
Great. All right. So Dr. Bruno is our next guest, and I am going to do a little introduction as well. We're super excited to have Dr. Bruno joining us. There's a lot of letters after Dr. Bruno's name that I don't know what they mean, but I do know that Dr. Bruno is a double-boarded family and preventative medicine physician practicing in a federally qualified health center here in Baltimore. We live, I think, a 5-minute walk apart, which is exciting. He served on the boards of the American Academy of Family Physicians, Physicians for a National Health Program, National Physicians Alliance, Committee to Protect Medicare, American Association of Public Health Physicians, Physicians for Social Responsibility here in the Chesapeake chapter, MedChi, Sugar Free Kids Maryland, Maryland Academy of Family Physicians, Baltimore City Medical Society, and a whole lot more. He also serves on the ethics panel of the Baltimore City Public School District and was a candidate for Maryland State Representative. So Dr. Bruno, thank you so much for being here, and I'm going to turn it over to you.
Thanks a lot, Kate, and good afternoon, everybody, and thanks for joining on this very important topic. Right now, we're seeing the results of the pandemic are just sort of a daily onslaught that I'm sure you're getting through your mail feeds, the TV news, and a lot of unanswered questions. A lot of we still don't know a lot about the coronavirus, despite all the research that is being done. We still don't know why it affects some people differently than other people. Why there's such a broad a pathology in terms of some people getting very sick and dying, some people getting sort of moderately sick, and some people really not getting sick at all, even though they've been exposed. So and I think what the problem with the wide differences in a coronavirus infection leads to a difficult task for public health leaders to sort of convey the importance of trying to stay isolated and stay safe as possible. So it makes it very difficult, I think, to convey that through messaging, public health messaging. However, I think that as we're starting to see sort of the light at the end of the tunnel, we have there's a few vaccine products that are in development. I just heard a talk from Anthony Fauci a couple of weeks ago saying that they're hoping that they'll figure out which ones of those vaccines will be safe and effective by the end of the year, and hopefully start rolling that out to high-risk populations in January and the beginning part of next year. So, I'm hoping that ideally we'll start getting people vaccinated and immune so that we can really start re-entering into society and undistancing to some degree. In the meantime, we are sort of in this difficult position of having to, upend our lives completely, do things, on a different scale than most of us have ever experienced in our lifetimes. And so it leads to all these questions about, what to do with our daily lives. And as Melanie sort of gave a great talk just a few minutes ago, it even leaves some of our public services and public works in a difficult position as well, because we're not getting our recycling picked up, and it makes it very difficult on sort of our daily lives. So I think what I'd like to sort of focus on during my portion is really kind of what we can do as individuals to sort of make sure that we're remaining environmentally responsible during the pandemic, but also what some of the hospitals and healthcare settings are doing or should be doing in order to try and continue to sort of keep our waste burden low. And right now, unfortunately, we go through a lot of personal protective equipment, a lot of PPE in the healthcare settings, and much of that is not recyclable or reusable. For example, the surgical masks that we typically wear, just in our sort of daily clinical use are not. I try to reuse it as much as I can, but really, we've been told, based on the best data, that you shouldn't be using it for more than 8 hours total, of clinical time. These masks are made of sort of an olefin fabric, which is, it is plastic, and many of the other things like gowns that we use are also made out of plastic. The gloves we use are mostly nitrile, which is a synthetic rubber, but again, not really able to reuse those. Some facilities have washable gowns that they use, but for the most part, I would say most of the PPE is single use only. So, we're doing what we can as healthcare systems to try and reuse them in a safe way. And if some things, like you can't reuse gloves, but you could reuse the masks, then we're trying to do that. And I think that's important because, as Melanie said, 9% of plastics are recycled. So it's very low numbers. So we're trying to do the best we can to sort of prevent and reuse it where we can. I think to some degree we're pretty lucky in Maryland because we haven't seen an uptick in the number of coronavirus cases that many other parts of the country are seeing right now. So our highest, well, currently the numbers that we have are 143,000 people have been infected in Maryland, with about 4,000 deaths. But luckily we haven't seen the positivity rate as high as it was in April, when it was around 27% of all tests were coming back positive. So I think based on a lot of the implementations that have been done to sort of keep people socially distanced and isolated, it peaked in April, and for the last 3 months, we've been hovering around a 3% infective rate, which has been great for the people of Maryland. But I think what, we don't know what the winter months will do. We're always cautious about the fact that with more colder weather and other viruses at play, especially the flu virus and other types of cold viruses, that people getting sick may spread those viruses and also coronavirus to each other. So being very cautious about that. And I think, just in terms of what we're trying to do in terms of, the general public, if people are eating out more, they may be getting more plastic silverware, in takeout orders. And, I think it behooves all of us to, make that when we order our food, you can say you don't need silverware, you use your own silverware at home and wash it, because we know that, washing silverware is an effective method of eliminating the virus. So, reusable utensils and other types of what are food containers are definitely preferred to reduce our overall footprint and our overall waste burden of the system, because those pictures of the wheelabrator that Melanie showed are just very overwhelming to think that it's so much trash is being burned on a daily basis and it has real public health implications and human health implications for folks who are at risk of not only respiratory asthmatic diseases in the areas, but other types of cancers and other things that have been linked to exposure of materials being burned in sites like that. So I think there's a lot to be done, and I think it behooves all of us to be cautious about that and work on efforts such as Melanie has mentioned, and with other organizations, Environment Maryland, that are really trying to make a difference and keep our waste burden low for people in our state.
Thank you so much, Dr. Bruno. I really appreciate hearing your perspective, and I think that, you know, everything you talked about kind of, I think something you said that I thought about was that the choices that we are making and the position we're being put in to have to make those choices are coming full circle and having an impact on our health and the health of our planet. And so it's so important for us to have an option and to have a way to not have to rely solely on plastic. And so I think that's actually a perfect transition to Dr. Loughlin to get into. We've seen all of these rollbacks. We've seen all of these, you know, this narrative that somehow plastic is much safer. I heard the plastic industry president say, plastic saves lives. He repeated it a bunch of times and it was dark. But as a quick introduction for Dr. Loughlin, really excited to have you. Dr. Loughlin is a healthcare futurist and COVID-19 public health policy advisor on both state and federal task forces. He has been providing oversight and guidance on current therapies and vaccine candidates for COVID-19. He's been widely featured in the media amid the pandemic. If you want to read articles, I have them all and can link to them or send them to you. And he's guided national public policy and discourse on the best ways to get us out of this crisis. So Dr. Loughlin, thank you for being here, and I'm going to turn it over to you.
All right, thanks, Kate. My pleasure. And thanks for being here with me, Dr. Bruno. Help field some of our questions. I wanted to first and foremost dedicate my time on the webinar today to a friend and colleague of mine whose name is Rue Morrison. He's much more of an expert on the environment than I, and he's amidst the fight of his life with glioblastoma right now. So I kind of wanted to just take up the mantle on his behalf, as well as for the sake of all of our communities to be here. As you mentioned, Kate, yeah, so I've done, since early April, I think I've been, well, maybe late March, I've been involved more and more in a lot of different discussions about zero waste initiatives and reuse and kind of some of the rolling back of the plastic bans. I've worked with a lot of agencies and organizations like NRRA, Upstream, Reusable, City to Sea in the UK, Break Free from Plastic, which is led by Judith Enck, and many others. And, you know, I think what the common denominator is that, you know, something that I kind of thought about parting with today, but the stuff that we throw away isn't going anywhere. We're living on the surface of a sphere and it's a closed system. So when we throw things away, they haven't really gone anywhere and we still have to live with it. And so, you know, whether we dispose of it and we think it's out of sight, out of mind, it really isn't. And you know, I think something that Melanie showed in her slides, which was seemingly true. I've seen a few different models converging on this notion that by 2050, the amount of plastic waste dumped in the oceans will exceed the weight of all the fish in the oceans. And that's based on a calculation that was done that suggested that there's 8 million metric tons of plastic waste entering the ocean every year. And so if you basically run the math for the next 30 years to 2050, it's a lot. You know, it's unfortunately an inordinate amount. And it equates to about the size of a standard garbage truck full of plastic getting dumped into the ocean every minute. And, you know, having come at this more from the public health policy side and more of like the medical science side, you know, I've sort of had to really upskill myself as far as what the impacts of some of these wastes are that impinge upon us. Like, you know, what is the impact of microplastics? So microplastics, you know, become these plastic particles that degrade in the oceans, you know, and even sometimes on land and with wind. But basically the microplastics refer to very small particles of plastic, which, you know, can easily be breathed deep into the lungs. They get swallowed all the time. We eat microplastics a lot. There was some research on tea bags, plastic tea bags, donating a lot of microplastics to tea drinkers and all of this. And so, we're constantly bombarded with microplastics. And it's interesting because thinking about, does it go away? When microplastics get smaller, they tend to theoretically present even more risk to us as far as our health is concerned, because when they get beyond a certain size, they can pass through the intestinal lamina. They have an easier time passing through the alveoli in the lungs and getting into circulation. And they start to get to such a small size that now they're basically circulating in the bloodstream, competing with other molecules. And that's really a bad situation to be in. And then also, as Melanie mentioned in her slides, the incineration end. So, we're basically just surrounding ourselves with vaporized plastic effluent. So, it's sort of unfortunate to have a doom and gloom scenario, but unless we approach this in the right kind of way, it really very much is the potential doom scenario. And so I think kind of tying plastic in with the pandemic, one of the things that I would want the viewers to think about is when we consider that the plastic is disposable and therefore not exposing us to risks from the pandemic, we're basically just mortgaging our future for trying to feel satisfied in the current state. So it's not going anywhere. So all these food takeout boxes and plastic utensils and PPE, masks and gloves, they're still around and they're still causing us harm. And if you think about the relative risk about what harms that's preventing in terms of COVID and other disease transmission, I think we've really tipped the balance in favor of we're causing much more harm by using all of this plastic and having it be disposable than the harm that we would experience if we took smarter methods and still continued to use reusables and face masks for the general public that are cloth, for example, so they can be reused many, many times. And so in my mind, there's always that balance of risk versus benefit, and certainly the disposable plastic end is not risk-free. Where did you want to go next with it, Kate?
There's so much that I'm processing that you've said that I feel like I'm glad we're recording this, because both of you kind of said these things that just made me have to be like, whoa. So thank you. I think that, what I would like to get into a little bit, there's a couple different directions, but I think the easiest way to segue is to talk about, you mentioned the safe use of reusables and the ways in which we are creating a bigger problem for ourselves when we actually could just be staying safe while also not exacerbating the crisis of plastic pollution. So I wonder if you could just talk a little bit about the ways that, we have a lot of people on here and all of us have to go to the grocery store, all of us need food. What are the ways that we can make sure we're keeping ourselves safe and cashiers safe while also using our reusables?
Yeah, so from my perspective, and I'd love to hear Dr. Bruno's as well, it comes down principally to distancing. If you remove the pathogen from your vicinity, you can't have it transmitted. So distancing first and foremost. So if you keep yourself away from groups, away from infectious people, it becomes impossible to become ill. When distancing is not possible, this is where we've got, stay as far away as you can, make sure you wear a mask. Ventilation is probably second in line in importance, because if you've got, let's say, MERV 13 filtered air, as in some clinics and some schools I've worked with have installed MERV 13 filters. This at least allows for several air exchanges per hour, and you're able to scrub the air of smaller particles. All very important. I think, something else for the viewers to consider as well is that we still really haven't had a case of contact transmission of COVID-19. So it's a respiratory pathogen. We know a lot about coronaviruses in general, and they're very fragile viruses. They have a lipid bilayer, which is very susceptible to surfactants, and that's why hand sanitizer, alcohols, benzalkonium chloride work very well. It's why soaps work very well. They basically disrupt and digest this fatty envelope on the virus, and what that allows it basically to do is degrade, and all the RNA contents of the virus spill out so it can't infect anymore. So the idea of surface cleaning and worrying about surfaces and conveyor belts and stores and things is really a lot of misplaced symbolic theater. I think, being cognizant of distancing, trying to stay away from groups and shop retail and grocery and restaurant and food pickup when it's less busy is certainly helpful probabilistically. Making sure that not only with distance and ventilation that you're always prepared to have a mask on when you're in public, just to, again, reduce the probability. It's not going to be foolproof, but I think we've seen good empirical evidence from a lot of countries who have really enforced mask use. So at a population level, it seems very clear that masks do a good job at keeping people safer. They're not a panacea by themselves. And there's been some research kind of on both sides of the fence. Are they effective? Are they not? It seems at a population level that they do work. And so it's just, at the moment, kind of the right thing to do. And I would say, as far as like the disposable masks, a lot of them have been made in China. And I remember back in February, the daily production of face masks in China was about 116 million. Which, just sounds like a lot. We throw out big numbers, tons of plastic, lots of masks, but that's like 12x greater production rate than it ever used to be. So in cranking out all these masks, we've gotten to the point now of literally billions of masks made, disposable ones. And as Dr. Bruno mentioned, these are oftentimes spun plastics. We have created a situation where the latest stat that I saw about the volume is that if you stitch together all of the disposable face masks, it would cover a surface area larger than the country of Switzerland. And, again, going back to my opening salvo, these don't go anywhere. So how we reclaim these and process them is really going to kind of determine, along with everything else. And I think maybe, we get into the reusable thing next, but it's really going to determine our future.
We have a couple questions coming in, but Dr. Bruno, I just want to give you an opportunity if you want to add anything to that before I start asking questions.
Yeah, I completely agree. And I think Dr. Lockwood hit it right on the head is, the best that we can do and the best evidence shows that distancing masks and either filtered air or outdoor environment is usually going to be the safest way to prevent passing the virus along to anybody or catching it yourself.
Great. And we have some questions coming in. If you all, just for a note for our panelists, if you do want to type into the chat and answer, you just need to change who it goes to. It naturally defaults to just sending to the panelists. So you just need to click the all panelists and attendees option. A question that I think goes right in line with what we were just talking about as far as how to protect ourselves. We have two. One question says, does UV light kill the virus? Mute. There you go.
As I understand it, it does, but Dr. Lockwood probably has a better, you may have a better sense for it than I do.
Yeah, it does. That's kind of really the basic answer. There are some who contest that 254 nanometers is the best frequency of UV wavelength. There are some others who say 222 is the best. On one hand, I would almost say it's splitting hairs because there are UV lights that are made for this purpose, disinfectant lights that are used in clinics, hospitals, laboratories all the time. They do work, and here's the upside. Although with the US entering the fall winter now, there's less UV, frankly. That's why you really can't get a sunburn in the northern hemisphere, well, depending how north, in the wintertime. During the summer months when we had lots of sunshine and people were availing themselves of the outdoors, you got all the fresh air in the world, literally, unless it's contaminated with incinerated plastic effluent. And so not only is there lots and lots of fresh air volume, but the sunlight itself is providing an incredible flux of UV. So if you went to a park and there's nobody around and the picnic table's been sitting out on a sunny day, except in the shadows where it's been blocked, let's say, in between the slats and things, every surface that's warm from the sunlight has been exposed to a tremendous amount of UV. And there's no reason to wash down the table, nor has there ever been. So I would say, yeah, UV works very well. Some of like the toothbrush UV sanitizers for home, they're not enough power. They're battery powered often and things, but it definitely does. So I don't know, what the question was in regards to if they have something at home to do it, but UV does work.
Okay. That's great. And this question, I think, goes back to what we were talking about, the fact that we haven't actually seen a case from transmission. And the question is there any evidence that reusable shopping bags specifically are a vector?
So I'll jump in on that one and say, in theory, any what we call fomites, so a surface that can transmit, so a pen, a shopping bag, a door handle, an escalator handle. These fomites are vectors for transmission of anything, food poisoning, potentially, noroviruses, if you've got something, colds, flu. So yeah, you could say that if somebody was ill, coughed on their hand, touched a bag, and then you grab the same handle within minutes, there's a risk, but you would have to then bring your hand to your eyes, into your nose or your mouth to inoculate yourself. Just being on the bag poses no risk. And, depending on the type of surface, we know that the SARS-CoV-2 virus doesn't really persist very long with no host cells. So between 1 and 3 days, maybe, on plastic, stainless steel, wood. So the more porous, the more desiccated the surface, it gets harder for the virus to persist.
And is that, either of you might have an answer to this as a follow-up. It doesn't sound like reusable bags would be, if you had that very specific situation, would that also still be true if it was a single-use plastic bag, as far as the surface transmission piece goes?
Yeah, it'd be the same, I guess, except for the disposable bags. The plastic ones are a smoother plastic film. And so I would imagine that the nooks and crannies different on the reusable nylon bags would be a little different. In which direction, not sure, but if you've got somebody at the store and the retail policy is bag your own, put your stuff on the conveyor belt, bring your reusable bag, go down, pay your bill, rebag, so nobody's touching it, the risk is almost eliminated. And the reality is, if you touch someone else's bag, the chances that that's going to pose a threat is unbelievably low.
So we have a question here that's partly a question and partly a statement. The plastics industry wasted no time in spinning a tale that single use equals hygienic. Can both doctors please dispel that? And if I could continue to lead the witness, disposal of single use items adds to the pollution that worsens our health more broadly, correct? Sustained, Janet, I'll allow it.
Go, Dr. Bruno.
Yeah. Oh, yeah. So, I think, yes, I would say that single-use, the risks and benefits of using single-use plastics are not as cut and dry. It's not that single-use is necessarily more hygienic than using a reusable utensil, as long as it's cleaned and appropriately. Where I think we have to sort of dispel the myth is that the push to use more and more recyclable material, non-reusable, single-use, should be met with resistance based on the available data. And so I think we should sound the warning bell on that.
Yeah, I agree. I think with the disposable utensils as an example, we've proven through literally trillions of meals over decades that going out in public or home washing with either hand wash or dishwashers does a sufficient job at eliminating pathogens. And how do we know this? Because some of the top foodborne illness organisms are Campylobacter, Salmonella, E. coli. You don't often go to a restaurant, in fact, I think almost never, where you eat off their clean silverware, which has been used thousands of times, and get ill. And so the coronavirus poses no different threat. And relative to some of these other microbes, it's even more fragile. So the idea that we shouldn't be reusing silverware is crazy. And I think you know, my conjecture kind of has been since the start of this that, notice I didn't use my hand to rub my nose, it was the back of my wrist. Ever since the beginning of all this well, it was probably early mid-March, I wonder about the chain of causality for getting disposable utensils to the customers anyway, because there has to be a supply chain. So somebody's still touching this stuff. So you touch the wrapper or the disposable, somebody's already touched it. So it's already as contaminated as a reusable washed piece of silverware. And similarly with, you know, disposable cups at the coffee shop, you know, I know we were going to talk about reuse, but if things have been washed properly, it comes down to, you know, don't touch your face during cold and flu season, especially with COVID around. Keep your hands cleaned and sanitized and go about your life, because you're not going to get something from a cleaned coffee cup that you bring to a store and refill with hot coffee.
Absolutely. I'm scrolling through here. So this is a question that the speaker, excuse me, this is like so hard to scroll. Got so many good questions. The reluctance of Americans to wear masks is this question, or this attendee feels that it's connected to a reluctance to care about plastic waste. How has the medical community attempted to behavior to encourage, to encourage patients to think about the consequences of their personal actions on society?
Yeah, that's a great question, and it varies wildly. You know, I'm a member of an organization called Physicians for Social Responsibility. We work on a lot of environmental issues and nuclear war, and you know, we have initiatives in, you know, all over the country to try and encourage physicians to talk to their patients about these exact things. It's not something we learn in medical school or residency. It's something that we, you know, have to believe in as providers and good stewards of health, over, you know, the overall health of our patients, beyond the sort of the medical care that they're receiving in the hospitals and the clinics, and keeping an eye on those environmental effectors of people's overall health. So I think it's very important. There has been some initiatives here and there. There's something called the Global Green and Healthy Hospitals Initiative, which is an international effort to try and encourage hospitals to take greater care of their patients, not only in terms of like the food they serve in the cafeteria, but also like the utensils that they serve, the plastics that they use when they're, you know, putting IV lines in people or doing intubations, and looking at ways of decreasing the overall waste burden, and the cleaning, you know, materials that they use, the sprays and the cleaning, the toxic sort of cleaning solvents that are used to clean one hospital room between patients. You know, so it's a pretty comprehensive set of guidelines that hospitals can adapt and get sort of recognition as a green hospital. So those are some of the efforts that are being worked on, and I think that there are things that we should be encouraging, you know, physicians and providers around the country to be taking a look at.
Dr. Loughlin, anything to add on that one?
No, I think that was perfectly formulated.
Great. And I think, I mean, I'm not a panelist, I'm the moderator, but I also think organizations like ours are also trying to work really hard to get that education out there and make sure that people understand, you know, as Janet said in the chat earlier, we say throw away, and what does that even mean? There isn't a way. And so I think that's something that, with everything being virtual, we've been talking a lot to students, to young people, elementary age students, and they seem to have a better grasp on it than a lot of the audiences we speak to, because I think we're, you know, like you're both saying, we're in this time now where it's unavoidable and it's you can't not see it anymore, I think. So this is a question that takes us away a little bit from reusables, and I do want to get back in our last couple minutes here to just, I want to save time for you all to kind of give your solid advice on, you know, wash your hands and wash your reusables, and kind of, I want to make sure you all have time for a closing monologue. But the question I see here is, with such a wide variety of masks now being available, could you speak to your recommendations? For example, if going to the grocery store, would you recommend a higher grade of mask and walking in your neighborhood. And then maybe you could also touch on, the safe use of reusable masks as opposed to these disposable spun plastic. I happen to have this Star Wars fabric flannel mask that I love that one of our Environment Maryland members made for me. So that's my favorite mask, Cindy, but I will let the actual experts answer you.
Well, I have a few masks here I can show you. The mask that I wear when I'm testing people for coronavirus who have a high probability of having the virus, I'm using my N95 mask. Now this particular N95 mask has a valve on it. So I do end up covering that with a regular surgical mask and get kind of double protection there, in addition to goggles, gown, gloves, foot booties, and a hair protection. So that's like my full PPE regalia that I put on when I'm doing testing of high risk individuals. But for general use, I'm just wearing a cotton cloth mask that my wife made me, and it's just it's the cloth. I feel comfortable with the cloth itself, and I'm not getting closer than 6 feet to individuals while using my cloth mask, but I do wear it anytime I leave the house, whether I'm walking the dog or going to the store. So I think, for the most part, I think general everyday use, a cloth mask is appropriate. Now, some of the, bandanas and other things that may not completely cover your mouth and nose completely are probably not a good idea. And look for, if your mask has a valve on it, I would recommend potentially covering it with another mask.
Yeah, great advice. I agree. I think there were several studies that have been done on differential materials and how they perform. And so they've got things like the spun polyolefin, they've got cloth, double layer cloth, polyester, bandana type things. And, again, it's very difficult to glean truth out of it because in replicating the trials, nobody's really come up with the same ground truth. But, what is clear is, again, that on a population level, masks seem to work. And if you do have a cloth mask, if it's at least double layer, so what that generally means is it's either 2 layers of cotton cloth or you've got a hydrophobic outside layer. So you've got some kind of polyester outside, and then you've got like a hydrophilic interior cotton layer, which is softer on your face and it absorbs moisture. And that way, as the humidity rises from you exhaling, it's able to absorb that in the mask, and the 2+ layers of material help to do more filtration. There are KN95 masks that are pretty widely available, so they're not rated as highly as an N95, but the KN95 material is pretty robust. The FDA gave emergency use authorization to several manufacturers, but then kind of over the course of the summer, they rescinded their EUAs to some of the manufacturers out of China because the material wasn't what it should have been, and for a variety of different reasons. So they are sourceable. Then the question becomes, are you getting a reputable one? And if it's not a reputably made one, is it any better than a cotton mask? So I think to address the audience member's question, I think the best mask is the mask that somebody will wear. So if it's uncomfortable, if it's loosely fitting, if you hate it and you wear it less, then it's not going to do its job. So I'd rather a very comfortable mask that's not as good. And then I also, because of that, would remind myself that, my mask is not the only solution. So I also have to be a little bit careful and distanced. Whereas if you have a false sense of security, you may lull yourself into thinking I can do anything I want because I'm wearing a mask. And then that's a little bit more of a risky pantheon of behaviors.
Yep, that's a really important flag. And I've certainly seen that in my family as well. As this, it's like the cure-all. I'm wearing my mask, so it's fine. So I think that we've really gotten through our questions. I think some people have put in the chat some books that they like and some other recommendations. What I want to do now, we're in the final 5 minutes. I want to give you each like a minute to just sort of get your final thoughts and suggestions out, and then I want to talk to our audience for a quick second about how you can engage with our work. We have a great petition that I'll put in the chat, but Dr. Bruno, do you want to do a quick just summation of all the great stuff you said today?
Yeah, well, I just want to thank you again, Kate and Dr. Lockwood, and to Melanie earlier, for just helping inform me on a lot of things and helping me learn. I think this has been a wonderful conversation, and I'm very happy to continue to be a part of the efforts that are going on with Environment Maryland and throughout the state to really try and make a difference on these very, very important issues. I would encourage our audience members and the folks who are participating today to continue to look for ways to be helpful, whether it's getting involved with Environment Maryland and organizations that are really focused on the importance of environmental stewardship throughout the pandemic, while keeping yourself and your family members and friends safe. And I think we're going to get through this together. This is very important. And once we're post-COVID, I think the work will continue and be, as important as ever, that we continue to push for a future here on Earth where we are doing the best we can to keep our entire world safe and fit for the generations that come. So really appreciate the chance to be here and talk with you all today.
Thank you so much, Dr. Lockwood.
Yeah, thanks again, Ms. Bryman and Dr. Bruno for allowing me to be a part. It was great also to hear from Melanie. Thank you to all the audience members for sending us in insightful questions. I think we more or less answered all of them, but if you didn't get your questions answered, I don't know how we can do that, but stay tuned.
You can always email, you can always email it to me and I'll pass it on. I'll put my email in the chat as well.
All right. Yeah, and I guess as we get into the fall and winter in the Northern Hemisphere, we're going to get dry, colder air. The holidays are coming up. And I think that that always is what really kicks off things as far as transmission of seasonal colds and flu. And that's going to be concomitant with continuing coronavirus cases of the subtype COVID-19 cases. And so, the problem becomes, are we ready for dealing with holidays that may not be the type of travel and family gathering that we're used to, and how we behave in that context, I think is going to matter as far as future cases. So we've got to be smart. There are currently, I think, 11 vaccines that are in phase 3 trial. So definitely in the middle of next year, we'll have widely distributed vaccines as long as they get approval. But even the a couple of the front runners like Moderna's mRNA 1273 vaccine, it's not even finished its phase 3 trial yet. So by the time we get data readout and FDA to adjudicate, we won't see widespread distribution. I don't care what anyone tells you, until probably end of Q1 2021. So we've got a lot more months ahead of us of doing all the same stuff we're doing. And so be your own best advocate by staying smartly safe. And I guess, in the context of the title of the webinar, the plastics in the pandemic, what I do know is that future us will look back on this time period and wonder how we could have been so stupid. So I think that's where I'll leave that, which is, a good thing, because I'm included in that. We obviously aren't handling this as smartly as we should be. We can always get better. So I think we should take best science and evidence and try to do a better job. But I think this time period is going to be very difficult when everyone looks back about what we did with COVID-19, with disposables and everything. It won't reflect well in the future.
Yeah, I think that's that's a great end poll quote. We will look back on this time and wonder how we could have been this stupid. So thank you all. And I really want to do a special shout out for Martha Ainsworth with the Sierra Club and all of the Sierra Club members who joined us today, Clean Water Action, Shane from Trash Free Maryland, and Elvia from Annapolis Green. They're all on today. They broadcast this to all their members, and they are invaluable partners in this work. Environment Maryland works in such a close coalition, and I just want to really shout out those groups and those people in particular for all of their support on this. Martha put in the chat that if you want to join Sierra Club's Maryland Zero Waste team, you can, in the link that she included. I'm also putting in the chat a petition that we built. You can put in your own words on why you care about this, and it'll actually send directly to your state rep and state senator to say, look, you've got to take action on single-use plastic. We can walk and chew gum at the same time, right? We can fight a pandemic and make sure we're not trashing our planet at the same time. So please sign that petition, share it with anyone who you think would be interested, and it just really helps us do our work by letting your voice be heard. I'm also going to put in the chat the link to the South Baltimore Community Land Trust donation page, which Melanie shared. In addition, if you like our work and you like the campaigns we're doing, you can always donate to Environment Maryland. If you go to our website, there's a handy donate page. I appreciate all of you for being here. Dr. Bruno, Dr. Loughlin, thank you so much. And I hope you all stay safe. My favorite thing to say now is I hope you're staying positive and testing negative.
Thank you.
Okay.
We had an
Thanks,
excellent
everybody.
time. Cheers.
Bye.
Have a good one.